coughing is an elimination process. You know, a medical doctor here, Dr. Kasi, said it's a reflux reaction caused by irritants like dust, smoke, pollution, mucus getting inside of the system. Then we talk about, you know, is it dry or wet? Basically, a productive cough is when you're coughing up, you know, mucus and phlegm. And a dry cough is when you cough and nothing comes up. So the cause of this, it can be infections. It also can be, you know, asthma. It can be allergies. It can be medications. It can be heart problems, airway infections, lung disease, damage to vocal cords, and even sleep apnea can cause chronic problems. Now, one of the things that I think is the most common and neglected part of looking at chronic coughs is it's the digestive system. So many times heartburn and silent acid reflux causes coughs, and then it gets like, you know, blamed for something else. So with coughs, that always the place to start is your digestive system and seeing if we can improve your GI health. Okay, how to stop coughing. Stay away from allergens as possible. Like really try and clean up your environment, putting in filters, shut the windows, avoiding pollution, which is easy to say and hard to do. I see also a lot of coughing problems with sleep apnea. So it's important to do a sleep apnea test if the other treatments that you have haven't responded. If you have asthma, we've talked about this inside of the Thrivers program, but now I get to tell you a little bit more. Make sure that you're evaluating treating the infraspinatus muscle. Now, this is one of these neat breakthroughs that most doctors don't know about. If you're having chronic cough problems, literally the muscle that is right behind the spine of the scapula. So you have your shoulder blade here. You can find out this little ridge here. Right underneath that is the infraspinatus muscle. The infraspinatus muscle is related to the C4, C5 nerve root. The front part of that goes to the lungs and to the diaphragm. And when you have muscle imbalances in the infraspinatus muscle, it causes basically a conflict or a traffic jam inside of that C4, C5 nerve root. And what happens is it causes lung problems. I've had a lot of people respond really favorable to that infraspinatus respiratory reflex, where you can treat that muscle. And then what happens is their breathing improves. Also, there's a Japanese herb called yakatron. It's really good. It has an antihistamine effect. It cleans out the thyroid and it helps the adrenal glands, which is secondary glands of detoxification. Also, with breathing difficulties, make sure this is the number one thing. If you're having coughing problems, I said breathing, but I meant coughing problems. You got to look and help the GI system. Like that, in my opinion, is the number one cause of coughing that's not infectious related. So if you get a cold or flu, if you have bronchitis, like of course that's what's causing it. But when you have chronic cough, most of the time, in my opinion, it is inside of your stomach. Now, another one that seems to be a frequent cause of coughing is cockroaches. So there's, you know, this extermination plea. Where I live, like I'm sure that we have cockroaches, but like I haven't seen a lot of them. When I was living in California, we did a couple service projects in our neighborhood, and man, I saw a lot of cockroaches. If there's an infectious component of coughs, it's about your immune system and doing some cranial adjusting. So you want to stimulate the immune system, but there is an amazing treatment called endonasal treatment, which is a way to help rebalance the bones inside of your skull. This is not something that I learned in school. This is something that my dad taught me, and talk about an amazing, powerful therapy. It's endocranial treatments, or nasal specific is another. Now, some neat treatments for chronic cough, like 2 to 3 teaspoons of honey before bed seems to help loosen mucus. Also, you know, a little bit of honey in a caffeine-free tea, like an herbal tea. And I like teas a lot. I really like green tea. I like black tea, marshmallow, ginger tea. Like there's so many teas that I think are healthy, as long as you don't turn them into basically some type of, you know, sugar drink. I've had people be like, yeah, you know, I really like that tea recipe that you told me about. You know, I just have to put, you know, a little bit of sugar in. And we all have a tendency to underestimate how much sugar goes in. If at all possible, sweeten it with honey, or even better, drink it unsweetened. Put some lemons in it. Lemons are really anti-inflammatory. Pineapple is another really neat thing that helps with breathing conditions. Contains bromelain. It helps to thin the mucus and suppresses coughs. Gargling with salt water, about a half a teaspoon of salt with 8 ounces of water. And this is where I make the plea of like either natural sea salt or Himalayan rock salt. I don't like the iodized salt. You want a natural salt. You usually know if it's good if it's a little bit on the gray side. Like if it's completely white, I think it's been too modified by men. Sometimes with, it's just caused by a common cold. So decongestants, chicken noodle soup, fluids, thyme, vitamin C, liposomal vitamin C, echinacea, garlic, elderberry. Like I like all of those things. So for severe coughing, that, when people are like, I'm not too bad during the day. When I go to lie down, it's just, I can't cough, cough, cough. So immune system stimulation, cranial adjusting, thoracic spine adjusting, using diathermy and acupuncture, dilute hydrogen peroxide therapy. These are all things that you'd like to do inside of the office. And then as an ending slide, this like some natural cough remedies. I just love honey. I think it's such a neat thing to help infection. I've seen a lot of MRSA. I've personally treated people that have methicillin resistant Staphylococcus aureus that's not responsive to antibiotic therapy. I've seen some really good improvement by putting natural honey on it. Probiotics help the natural bacteria in your system. Bromelain from pineapple helps to, basically get rid of mucus. Peppermint, marshmallow, thyme, ginger, gargles. And then I love slippery elm. It's in a lot of the OTC products because a slippery elm is so good for your GI system. It helps everything. And then turmeric and curcumin, they're always getting all of this press and stuff right now because it's so healthy.